As new COVID mutations make vaccine data a bit confusing for many of us, and data for both of our approved vaccines and two others show reduced efficacy against them, experts say nothing is more important than this bottom line. None of the 75,000 trial participants who received one of the 5 vaccines with public data died from COVID, and hospitalizations were dramatically reduced. As David Leonhardt writes in today's New York Times, quote, many people are instead focusing on relatively minor differences among the vaccine results and wrongly assuming that those differences mean that some vaccines won't prevent serious illnesses. Let's bring into our conversation Dr. Ashish Jha, Dean at Brown University School of Public Health. This was the kernel of good news in all of this that I was looking for. You look at the Biden White House really starting to tell the American people the truth about how long it will take to ramp up production and distribution of the vaccine. You read the terrifying headlines in this country and around the world about the mutations. This feels like a reset. How should we look at this news about the protection offered by the vaccines?
Yeah, so first of all, thanks for having me on. You know, the challenge here is we focus on these top line numbers of 65% effective, 75, 85. What we really care about is avoiding hospitalizations and avoiding deaths. That's what matters. And we have not seen a single person die who's been vaccinated with one of these vaccines. And it's controversial whether anybody's even been hospitalized or not. So the bottom line is these vaccines are incredibly effective at preventing bad outcomes. They may vary a little bit on whether they impact your ability to get infected. But what we really care about is those bad outcomes.
Are you optimistic that that goal of vaccinating 300 million Americans by the end of the summer could be achieved sooner if there are more vaccines available, like the Johnson & Johnson vaccine?
I am. Look, it's an ambitious goal, but I think it is a doable goal. I do think we'll have the Johnson & Johnson vaccine. I'm hopeful that the FDA will authorize it based on the data we've seen. I expect that we'll have a couple of others, Novavax, probably AstraZeneca. And my guess is that by the time we get to May, June, we will have plenty of vaccines for everybody. And then the key will be to help deal with issues like hesitancy and get people vaccinated.
One of the other goals of this new White House is to get in-person learning back for kids. And I know there's a lot of data about schools not being super spreaders like some people feared they would be. But that really seems to affect just kids. Teachers are still at risk. Would you urge all states to add teachers to the front of the line for whatever vaccine supply they have?
Yeah, so first of all, in terms of schools, absolutely critical that we're not just talking about keeping kids safe, we're talking about kids and teachers and staff safe, which I think the evidence now is very clear we can do. But of course, adding vaccines for teachers would add another level of safety, as would adding testing in schools. So I think there's a lot we can do to bolster confidence. I've been pretty supportive of states that have put teachers at the front of the line.
Dr. Jha, what is it that takes so long? I mean, we have the vaccines, which feel like in part a miracle of science. We have a new administration that has the will, that's using all of the power of the bully pulpit to cure the country, to eradicate coronavirus. Why is it going to take until May, June, July, August, September to get enough of our citizens vaccinated in a way that protects the whole population?
Yeah, there are two sets of things happening here. One is we should have had a lot more vaccines ready last fall and winter. And I don't totally understand why Operation Warp Speed didn't deliver on the number of doses. Even in October, Secretary Azar was saying we're going to have 100 million doses available by December. Obviously, that turned out to be way off. So that part is puzzling. The second thing for people to remember is that it's a global pandemic. And lots of countries want vaccines. The Europeans do, the Asian countries do. And so these companies are working pretty fast, but they can only produce so much. I think there's more we can do to bolster that production. And I suspect we're going to hear more plans from the Biden team on that.
Like invoking the Defense Production Act and bringing more national federalized resources to bear?
Yeah, and also looking at other companies, other pharmaceutical companies that might have capacity and seeing if we can use other people's capacity. There's a lot to be done here. The last administration just did not seem like they were as focused on this as needed. I'm pretty confident the Biden team will.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.